Welcome to another installment of patient testimonials from the American Association of Hip and Knee Surgeries. This testimonial will be, it's all about the work mode. This is a testimonial of Michelle Menconi, who underwent a successful total knee arthroplasty, as pictured here to the right as a schematic and a radiograph of what a typical total knee arthroplasty looks like. Michelle is a member of the AAHKS Patient Advisory Group and will share her thoughts on total knee arthroplasty, the recovery, and the future for surgeons and patients. Hello, today we have Michelle Menconi with us. She's an account executive at Iverson, serving on the board of directors at the Youth Outreach Services, and is also part of our patient advisory group for the American Association of Hip and Knee Surgeons. We're going to talk today a little bit about her experience with having a joint replacement and some of her feelings and opinions on the whole topic. So with that, Michelle, do you want to introduce yourself as well? Is there anything I missed?
Yes, I'm Michelle Menconi. I'm happy to be with you today. And I did have a full reconstructive of my right knee, and I'm doing great. But been almost exactly 1 year.
Excellent. When did you think that you might need a joint replacement? What kind of clues did you have?
Well, it was starting to limit my quality of life. It really was. I was not able to do the things that I would really like to do. And I probably noticed it for probably in the neighborhood of about 5 years that I had a problem because it started very slowly to limit my abilities, work wise, socially wise, everything, participating in some sports that I like and things like that. It really started to limit it. So I kind of tried to put it out of my head as best I could and manage the pain as best I was able. But it came to the point that my quality of life was not what I wanted it to be, and joint replacement really became a necessary um, option for me.
Excellent. And did you jump right in, or I know you said for 5 years it was bothering you. Once you felt like it was getting bad, did you jump right in, or did you try some other options first? And what were those?
I did have cortisone injection, and then I did have a synthetic injection. I don't remember exactly what it was. It was at for 3 weeks in a row to kind of increase the lubrication within my knee. I don't know all the technical side to it, but I think that was only allowed really a temporary type of uh, pain mitigation, but not. It didn't help enough. But I also just used external braces. I had a lot of Advil, a lot of Tylenol, things like that. But it got to the point where those things were only temporary reliefs, and it was not helping with the long-term quality of life.
And so, this is a little bit of a loaded question, but how did you select your surgeon?
Well, I did do research. I absolutely did. Had referrals through obviously family and friends, but I did look into Northwestern because that's who I've always been my primary care for over 25 years. So I did look through the options, but I also studied names of surgeons online just to see what their ideas were and their thoughts behind things. But quite honestly, it became a very easy solution because of the confidence that my family had and the knowledge of you and your great results. So to me, it became a very easy decision once I finally made the decision.
And speaking of that, what the process of making that decision, obviously it's not an easy thing to do. You got to take some time off of work. You need some help. Um, what went through your mind in making that decision?
Well, I'm one that once I make the decision, I just want to get it done. So I basically got to the point where I said, this is not the quality of life that I want to have anymore. It is limiting everything that I want to do. And I made the decision that I was going to work with you. I made an appointment with you and your team. And I think I was scheduled within like 2 weeks. And to me, that was great because it's I like to make a decision. I like to have a game plan. I like to understand what's going to happen and make it happen. So to me, that worked extremely well. The flexibility of your schedule, that was, and how easy it was to schedule. I felt very much in control of the whole the whole thing. So to me, once I had a plan, and it just became very easy to just check off the everything down the list.
So, and then, so then once the surgery was done, how was the recovery process?
Well, the recovery process, I absolutely allowed myself about a week to not have work interference and focus only on myself. So it became, just worrying about the physical therapy, worrying about what I ate, worrying about the medication, and everything that I needed to do to get the best result out of the knee replacement. So I allowed myself no interference from work. Almost at all for about the first week. And then the second week, it was very limited. I had allowed my availability from my teammates for only a certain amount of time per day, and it actually worked out pretty well. I was able to focus in on myself and my recovery and what I needed to do to, like I said, have the absolute best outcome.
So on one of on the last advisory call, you'd mentioned something called work mode. So it sounds like this is kind of what you went into. Can you describe that a little bit? Because one of the things about surgery is making sure expectations are right, and then the doc has to do what they need to do, and then the patient has to do what they need to do. So can you enlighten us on the on what work mode is?
Well, for example, that's what the month of January is to me. Is my team and I lead a group of teammates, and our goal is was mostly financial this year, and who we wanted to work with. How much volume do we think we could get, and what do we think? What are the right people for us to work with? It's going to help us achieve that goal. So right now we're writing our plan for the entire year. What where we're all going, where we're spending our time, the best use of every support. But that was the kind of the way I approached it. What is the best way to get the surgery done? What is the best way to have a recovery? And what is the long term goal that I want for the knee? So I really handled it like a business. This is what you need to do. This is the steps you need to take. I think I've achieved pretty much every single thing that I wanted to in this work mode, if you will. But I have struggled with the weight a little bit, and that bothers me a little bit because I put on a few pounds, and that bothers me because I work so hard to stay fit and to stay focused on the best possible outcome for the knee. So I'm really now back to that mode right now of making sure that I'm doing everything that I can, and also to avoid the second surgery, quite honestly, because I know that left knee is going to need something too. But I'm trying right now to focus in on, what I can do to have the best outcome for the knee replacement right now, and maybe what will help me. I know it's inevitable, but what will maybe spread the distance out between the next surgery.
That sounds like a good plan there. Are you back to full strength at this point?
Oh yeah, I can do pretty much anything that I want. Absolutely. I can do yoga on my knees. I was actually washing floors the other day on my knees. I can do anything. I mean, with some limitation. You can't really be on a hard surface with your knee for long periods of time, and but we usually do 4 or 5 mile walks on Saturday. I'm back to that with no problem whatsoever. I see no limitations right now. No.
Excellent. And as you look back on your experience, do you have any words of advice? I know you mentioned again focusing in on making sure you do what you need to do, but any other words of advice that you can put out there for patients who are thinking about knee replacement?
Well, I think you have to know what you want. You have to focus in on what quality of life do you have. And once you know what that is, set goals and realistic goals, and then have the steps up to that point to achieve the goals. That's the way I feel you're going to be most successful as a patient, is understanding the entire process, understanding that you are an equal part of the process. It's not all about the surgeon. It's not all about the knee. It's about everybody working together for the best result. That's how I approached it, and I would recommend that to any other patient. Know what you're you're engaging in, be a participant, active participant, and work together for the best outcome.
Okay, all right. So switching gears, trying to keep political affiliations aside. Um, what do you see are some of the challenges facing joint replacement surgeons, patients, medicine in general in the near future? Obviously, we have the pandemic going on, in the light of a lot of CMS changes with Medicare.
Well, that I wish I don't know. I don't know too much about, so I can only say that the financial side of it to for me was not part of the decision. I didn't. It was not the most important thing. Of course, after I made the decision to have the surgery, then I said, well, I should figure out how it's going to be paid for and how that's all going to work out. But obviously, having good health care is important. Understanding what they're going to cover, that's very important to me. But risk mitigation to me is the most important thing as a patient. I want to understand, am I going to be going into a healthy, am I going to be going into a place where I'm going to feel safe and healthy and come out? I didn't quite understand initially why there was so much cleaning ahead of time, why you had that process. And I followed it to the letter. As I said, I wanted to be an active participant in the process. So I followed it, maybe not completely understanding it, but it seemed like everything that I was told during and after was Dr. Levine has no infections. This is very important. It's as important as the surgery itself. So to me, that is very important to know. I was glad that I had um, that knowledge and that I did that. So you want to feel safe, and I think mitigating any risk is one of the most important things, and having a good insurance policy, I guess, is important. I was lucky enough to have the Blue Cross Blue Shield, so I was able to have some good advantages there. But to me, it's just as a patient feeling that I'm going to have great care and come out of it healthy on the other side.
Right. And so, one of the aspects and concerns for people who have Medicare and Medicaid is that there's concerns for some of the services not being available. Were there any particular services that you felt, whether it's physical therapy or your medical doctor getting cleared, or the hospital, or anything about the services you received that you would not want to see cut in the future for other people, or even for your other knee in the future?
I guess I was fortunate with PPO not to have to worry about the medical side of it. I mean, obviously, I did have to go through that and have a health screening and all that kind of thing prior to the surgery. But I have to say that I did have good physical therapy, or I did have access to physical therapy post installation. But I'm going to say that I don't think it was very good physical therapy. I mean, I'm not very comfortable with the partner that I chose, and I would love to maybe have had more access or different access to somebody. Even if there was a higher cost, I think I would have been more inclined to work with somebody, maybe a personal group or something like that, instead of a big box kind of a physical therapist, if you will. So to me, that was very off-putting, and I would definitely want to go a different way. So I would hope that there's options available to me, maybe different options, not just you can only go to big box A or big box B. I would love to know if there's, a private solution, perhaps that there's a cost involved, yes, but you're going to have a better result and more focused on me and my outcome. So, but I would hope that any of the challenges that you have can be overcome, because I don't imagine every patient has the ability to make a decision that doesn't involve the financial sides of things. I'm sure most people have to keep that you know, very much to the forefront when they make their decision, I would imagine.
Yeah, that certainly certainly can be an issue. We're really hoping that cuts don't lead to any of those problems. The last question relates to some things that Medicare has done recently that has driven some of the private insurers, but certainly the pandemic has kind of really brought out, and that's the concept of outpatient total joint replacement. That means coming in at like 8 o'clock in the morning and then being home at noon. And there are some pushes towards that being sort of the way things are going to go, and that's sort of almost mandatory. Um, for some people it's probably good, for others not. I mean, how do you feel about if you came in that morning, if by noon you were going to be at home and your family was going to kind of take care of you, and certainly again with Medicare patients who are more elderly, there are some concerns there. Obviously, we want to do it safely, but if there's sort of more of a mandate to that, how would you feel like if for your next knee, they're like, either you go home or you don't have it?
I have to say that would absolutely weigh into my decision. If I didn't have the option to stay and be cared for, I don't know that I'd want to do that. To me, I was healthy in general, and I did have the ability for some people to help me afterwards. But I couldn't even imagine going home 5 hours later. It was a big deal. I'd never had a surgery like that before. There was a lot of things that I didn't know that was going to happen, so I needed the help of a lot of different people within the hospital. And then if you may recall, I had a lot of challenges keeping my blood pressure up. It was very, very low, so for an entire day they were working to keep my blood pressure up. So I can't imagine how uh, taking the decision out of the hands of the surgeon makes any sense. And to me, it seems completely inappropriate that it should be at your discretion solely. If I'm fit enough and I'm good enough, and I'll approach the second knee a little bit differently. Maybe mentally I'll be a bit more prepared, and you can kick me out at the end of the day. Fine, I'll go home. But I think that has to be your decision, and mine, and not necessarily mine as a patient. Just for me saying, oh, I feel like staying an extra day. They've got good cable on the TV or whatever. That's not what I'm suggesting. It should be a decision that is the surgeon's decision, not the hospital, not the legislation. I can't imagine that that would be good for anybody, yourself or the patient.
Fantastic. Well, I appreciate you spending the time with us. Thanks for all your help today and on the patient advisory group. And I look forward to working with you more in the future.
Absolutely, my pleasure. It's nice to see you, and I'm glad I can help in any way. So I hope you have a happy new year, and hope to see you soon.
All right. Thanks you as well.
Thank you. Bye bye.
Bye.